if you get breast big C, is it a genetic disease?
Yeah. So many people think that diseases are genetic. And speaking across the board, and then we can speak specifically about breast cancer, but speaking across the board, genetic diseases make up a tiny fraction of our illness in this country. So the vast majority of the illness, the chronic illness in this country, and I'm talking about heart disease and obesity and hypertension and lipid disorders and depression and anxiety and Alzheimer's and all of those things, including cancer, these chronic diseases are not genetic. They are environmental. And the good news is that's the thing we have control over. We have control over our environment to a large extent. We're not going to control everything. Of course, we're not going to control everything. But we can control most things, and it's what we do most that matters. So even if you do have a genetic predisposition towards a disease, and we can talk specifically about breast cancer, there are certain genetic predispositions that make you more likely to get breast cancer. But the truth is that even when looking specifically at that population, when looking at the people that are at risk for breast cancer, they don't all get breast cancer. And that's because the environment plays a role. It's the effect of our environment on our genes that determines what happens to us. So the most famous saying is that your genes may load the gun, but environment pulls the trigger.